Hi everybody, this is Eric again. I'm the lead technologist for Sterling Urgent Care, and I'm going to make a series of videos critiquing each body part so we know exactly what we need to be seeing on each x-ray and what we don't need to be seeing, if we're missing something, if we need to take a different image or redo an image. So this is basically educational, just showing you what to look for and what you should be seeing, and some tell signs of if something's over rotated or under rotated. So I'm going to start with the C-spine series, which is the cervical spine series, and I personally always start with the lateral C-spine. And the reason I do that is the lateral C-spine is imaged at 72 inches, and the reason we do that is to minimize the magnification due to the neck having some space between the actual neck and the image receptor because of the shoulders. So we're just trying to reduce magnification. That's the only reason we do that at 72 inches. So for the lateral C-spine, there's certain things that we absolutely need to see. First of all, we need to see 7 cervical vertebrae bodies, okay? So here's 1, 2, 3, 4, 5, 6, 7. Okay, and then you can see the joint space between C7 and T1, and that is good. We need to be able to see that joint space. Now this is about as close as we can get to a good lateral C-spine and not have to take a swimmer's view, which we'll go over. Swimmer's view is so we can see T1 through T4 right through the shoulder area. There's more dense right there, so x-ray technique is great right here, but lacking right here. So we've got a light image. So we need to see 7 cervical vertebrae, okay? Now we need to make sure that there's no rotation. So the way we do that is we look for the anterior tubercle, which is right on the front of the atlas or the first cervical vertebrae, okay? So it should look like a D, which it does. You see this bony prominence right there, that's a tubercle, and it looks like a D. So if that's distorted in any way and doesn't look like a D, that means that you're rotated and you need to repair that. Another way we can figure out if we're rotated or not, we've got the posterior mandibular line right here that comes down like that. Okay, there's one on this side and one on that side, so they need to be superimposed over each other. And we can see on this image that they are superimposed on each other. There's no overlap or underlap anywhere right here. So those are perfectly superimposed, which means that this is a good lateral image, okay? Positioning wise, we're pretty good. This one could be moved up a little bit. Our centering point for lateral C-spine is C4, which is just below the hyoid bone right here. We're able to see the trachea coming down, and as far as collimation goes, we could collimate a little bit tighter. The only thing we really need to see is the skin borders on both sides, so we could be a little bit tighter on that. But good lateral C-spine. 7 vertebrae are present, and there's no rotation. So good job on that one. So let's move on to the AP. So we're going to move into 40 inches, and we need to be able to see at the very minimum C4 through T1, okay? So this right here, this vertebrae right here is T12, or sorry, not T12, T1, okay? And the reason we know that that is T1 is we can see the transverse processes coming off. and they actually point upward. Okay, just remember that T1 transverse processes point upward. Where you look at C7, that transverse process right here, they point down. Okay, so that's a good way to kind of find yourself. If you see those transverse processes pointing up, we know that that's T1. So we've got C7, 6, 5, 4, 3. So we're doing okay. So if you look close, you can see the dens through here in C2 and then C3. But we need to be able to see that a little bit better, which we'll accomplish that doing our odontoid or peg shot. So technique-wise, we're doing okay. It could be a tidge darker, a little more contrast, but we're still able to see what we need to see. So we're able to see the trachea coming down right here, and then there's a constriction in the trachea again. That is what we need to see. That trachea widens right here, so that's very good. We can see the pedicles here on each side, and it's fairly straight. So we want that as straight as we can. Okay, we can see the intervertebral spaces right here. Okay, this is actually a pretty good AP view because we're able to see 7 through 3, which is really good. Now, collimation wise, we could collimate a little bit more. Like I said before, we just need to see the skin margins. So that could be collimated in a little bit and centered a little bit better. Other than that, it's a pretty good picture. So just remember, on the AP, we need to see at least 4 through 7, but if we see 3 like we do now through 7, we've done a good job. And remember that T1 has upwards transverse processes and C7 has downwards. Okay? All right. Let's move on to the odontoid and what we need to see with the odontoid. Okay? Odontoid is one of my favorite pictures to take. I don't know if I've mentioned that before. Pretty cool, and usually the patients get a kick out of taking this image as well. As far as anatomy goes, this is a pretty dang good picture. Okay, so is what we need to see on the odontoid is, of course, the odontoid process, or the dens. That is where C2 comes up and into C1. That's what kind of holds your head in place. If you ever break that bone, you're in a bad way. Fortunately, that bone is pretty protected, so that's good news. So another thing we need to see through the open mouth is the zygopophageal joint right here. That's what that is. The zygopophyseal joint. That's a hard word to say, sorry. And right here, these bones right here, those are called the lateral masses. We need to see those without superimposition. Okay, we need to see the entire joint here and the lateral masses, along with the dens. We need to see that through the open mouth. Now, the occipital bone right here is kind of superimposed slightly over the top of the dens. So in order to fix that, it's all we need to do is slightly tilt the patient's head down. And I'm talking slightly, just a couple millimeters, and that will remove that. So say these upper teeth right here, say those were on top of the dens, we would just have to tilt the head back a little bit to get those 2 teeth out of the way. And I lied to you. The occipital, we'd have to move the head forward a little bit, okay, just to move that up out of the way. So technique-wise, this is pretty good film. Density is good. We're able to see sharp edges of the dens in both vertebral bodies, C1, C2, and we can see C3 right there with minimal superimposition. Collimation-wise, we could be a lot tighter. Okay, now we can usually collimate to the side of the jaw. Okay, and from top of the teeth to bottom of the teeth, it just basically has to be a neat little square that we can see C1, C2, and C3, okay, without superimposition. Now remember, if you've got the occipital in the way at all, just tilt their head down a little bit, and that will remove that up. If the teeth are in the way, tilt the head back a little bit, and that'll move the teeth up out of the way, okay? So critical wise is all we need to see is the lateral masses, which is the base of C1, the dens, which is the finger of C2, the zygapophyseal joints, that's a fun word to say, anyway, and part of C3 without superimposition, okay? And these need to be equidistant between, if that's turned at all, we know we're rotated. We want to keep those patients as straight as we can, okay? The back of their head directly against the image receptor, and the line between the EAM, or the auditory canal, and the upper teeth is the line we're going to want to have. Okay, so very good. All in all, a pretty good film. Just needs to be collimated a little bit more. But that just gives you an idea for all three of these pictures what we need to look for and what needs to be present on those images. Just practice it, review this video if you need to, just to make sure we're giving the doctor or the providers and the radiologist all the information that they need to have. Take pride in your positioning. I just think it's so important. We don't want to miss something because we didn't do a good job. It's more important than we think. So anyway, we'll see you on the next video, and we'll see what we need on other images. I appreciate you taking the time to be with me today, and I will talk to you soon.